everyone. Happy Tuesday. We're here to give you the latest on the COVID fight that we're doing here at the system with numbers increasing. We're going to speak with some of our cancer center providers and directors. But first, we're going to hand it to Lee to get the stats for today.
Thanks, Sarah. So the biggest stat I want to mention, we had our highest positive day since we started this pandemic. We had 34 positives on Saturday. The good news is that the death rate is down, the hospitalization rate is down, and it's mostly outpatients because it's a much younger demographic. More than half of the people that are positives are under 40, which again is a good thing, but you'll hear in a minute why we've still got to be careful and we're still concerned because those people could end up infecting people who are immunosuppressed or compromised or vulnerable. That's the important thing. But the thing we are trying to stress today is if we could ask people for one thing, it is when you have symptoms, no matter how minor, if you think it's sinuses and you don't normally have sinus problems this time of year, get tested. We have plenty of testing capacity, and we need people who have symptoms to isolate. Wearing the mask is important when you're in close quarters with someone or around someone who's vulnerable, but nothing is more important than isolating if you have symptoms. Cannot emphasize that enough, Sarah.
Absolutely. The days of going to work and pushing through those common colds or those sinus infections that you think you had are over because you could potentially be spreading it to people who are vulnerable. And with that, that's where we're going to talk to Dr. Bechtel. He's a radiation oncologist with the system. Tell us, Dr. Bechtel, how has COVID changed your world as far as radiation oncology?
Well, obviously we deal with a lot of patients, that, especially the ones getting chemotherapy, that do have compromised immune systems. That can make them more susceptible to getting coronavirus, and they may get sicker when they have it, especially if they already have other risk factors like obesity, hypertension, diabetes, the things we've heard about. So those patients are especially vulnerable, and we really need to protect them. And wearing our mask is one thing that we do to make sure that we protect them while they're in our clinic.
So how does a radiation oncologist treat cancer, so to speak, if we don't know?
We use radiation, basically a targeted X-ray, to target cancers. It's different than chemotherapy. Chemotherapy is going to go through your whole system. It's for when you think the cancer might have spread or become in the blood. Radiation is targeted right at your tumor. It doesn't treat the whole body. So it's right at where the cancer is. So you get side effects very much related to where the cancer is. And you come in usually every day for a series of weeks, depending on which cancer it is.
So one of the risks of going live is there was just a fire truck coming by there, but I want to go back to what he said there and what Sarah pointed out. Again, the days of fighting through it and thinking, oh, I've just got sinus problems, I'll fight through it. Well, you might can do that, but if you infect a person who's immunosuppressed, you could be the cause of that person's demise. So this is about other people, not yourself. Don't be selfish. Put other people ahead of yourself. And when you're around a person like that, wear a mask if it's immunosuppressed. But most importantly, if you think you have sinus problems, you normally don't, get it tested for the sake of those vulnerable people, right?
That's right. I mean, you're right. You're probably not going to get that ill if you're a young, healthy patient. But, we all interact with other people through the days, our grandmas, our, coworkers. And you never know. You may be interacting with someone who has a sick relative getting chemotherapy, whose blood counts are down. And that person may not be able to fight the infection well if they get it. And like you said, they could die.
Don't be a spreader.
Yeah.
Chip, tell us about some other things you guys are doing in the Cancer Center to keep people safe.
Absolutely. So, our patients in the Cancer Center, their immune system is suppressed pretty much by definition. Many of them are in active treatment. So what we did, back in March, our goal is to keep delivering all the care we've been giving, but do it in a safe manner for our patients. So for instance, we screen all patients, and if they have a visitor that comes with them, we screen them at the door for symptoms of being positive for COVID-19, which is temperature, cough, things of that nature. We also require everyone, employees, patients, visitors, to wear a mask. Anywhere in the Cancer Center, 6 feet or 12 feet apart, everyone's required to wear a mask. What the fear is, back to Lee's point, is that someone who is going to not show any symptoms, they're actually going to be positive and not know it, and they're going to bring that to our patients that are already immunosuppressed.
I can't tell you how many times, Chip, we've had somebody through our contact tracing say, well, I didn't really have any symptoms. Well, I did have a little cough, or I didn't feel well, or I was fatigued. And it's just people aren't recognizing those symptoms. They're trying to fight through it. Don't do that. Get tested and isolate. If you feel the most mild symptoms coming on, isolate immediately. But we appreciate what you guys do in the Cancer Center. Thank goodness for radiation oncology, something that has advanced so much over the years. And you can fight that cancer with pinpoint precision now. So come see these rock stars, and they'll take good care of you and get you through it. So appreciate what y'all do. But other than that,
yeah, we'll have a few more updates this week as the virus progresses and more positives come through. We'll be right here to give you the latest updates.
we will. So do the right thing, isolate, and stay senior and strong. We're going to put our masks on and go back inside there. But stay safe and stay strong.